I'm just seeing this just popped up. The House budget resolution. This again is the reconciliation bill. They have a real problem here because the one thing that the Republicans always care about, this is the only policy they have. To be fair, there's two. One is tax cuts for wealthy people. They will put some lipstick on that pig and do a little bit of tax cuts for other people maybe. But the bottom line is we need to put as much money as we can in the hands of wealthy people. That's it. And part of the way they redistribute that is pretend like, well, we need to have a balanced budget. We need to cut down on our debt. We need to cut our deficit. So they look for cuts to give themselves more room to provide tax cuts. And the only place for them to look for cuts right now is at Medicaid. But the problem is that 75 million Americans get their health insurance through Medicaid.
And then when you add children to it, it's around 83 million in total because that includes what, CHIP as well in Medicaid?
Yeah, I don't know if S-CHIP would be rolled into, or CHIP and S-CHIP would be rolled into it, but they're looking to get anywhere from like $800 billion over like 10 years out of this. And understand, something like 45% of children born in this country.
41% of births nationwide covered by Medicare.
Medicaid.
Medicaid, that's what I meant. Nearly 50% of kids with special needs get coverage from Medicaid. 5 and 8 nursing home residents.
Nearly two-thirds of everyone in a nursing home is there on Medicaid.
21% of Americans nationally. So that's 1 in 5 Americans gets Medicaid coverage.
I can tell you my experience. My mom, what happens is you spend down all of your assets. You get to keep like a car, I think, and maybe I think it was like $3,000 in Massachusetts. And then you've got to spend all that. And then you go into the nursing home, or you're in the nursing home and you spend it there, and then Medicaid starts to pick up the bill. So it's a completely insane system we have in this country. But Medicaid is what made it possible, and will make it possible for your parents, and has made it possible for my parents to get good care in a nursing home.
We have such a threadbare social safety net in this country, but these are the kinds of things that keep us from plunging our millions of people even more into despair. I mean, this is what's holding us all together here.
So here is the issue. You've got people who are on like so-called frontline seats. Republicans in California, Republicans in New York. I'm looking at a list right here of Republican representatives who won by a tiny margin. Arizona's first, Schweikert, won by 16,000 votes. There are 78,000 people who are going to lose their Medicare coverage, Medicaid coverage in that district. In Arizona's sixth, Cisco Mani won by 10,000. 105,000 people stand to lose their coverage in that district. Colorado's eighth, Evans, won by 2,500 votes. 73,000 could lose their Medicaid. In Iowa, Miller Meeks wins by 800 votes, 66,000 recipients of Medicaid. Michigan, in Nebraska, in Pennsylvania, there's 2 people. In California, there's 2. Iowa, another one, none. Michigan, New Jersey, in New York 17th, Mike Lawler. He won by 23,000 votes. There are 98,000 people on Medicaid. In Pennsylvania's 8th, Bresnahan won by 6,200 votes. 92,000 people on Medicaid. You see the problem that Mike Johnson has. That's where the money is. They can't justify giving all these tax cuts to their conservative members who are like, hey, wait a second, I thought we were about cutting the deficit. So they're in between a rock and a hard place. Let's go to Alfred. Alfred says he'll vote to cut Medicaid because he doesn't care. And we're going to talk about this waste and abuse.
The other question you got was about Medicaid.
Yes.
At the town hall this morning, the coffee. When it comes to Medicaid, some of your colleagues are considering cutting Medicaid in order to pass your budget blueprint, to get the tax cuts done again, and to get Trump's other legislative priorities. Would you vote for a bill that includes cuts to Medicaid?
I will vote for a bill tomorrow that has savings for Medicaid. And I'll tell you the difference. This is just not a nuanced position. There is waste, abuse, and fraud in Medicaid. We're finding out through DOGE and through the access to this data that there is waste, abuse, and fraud.
All right, pause it. Okay, first of all, there's a report every year by the DOJ and by HHS on fraud in Medicare and Medicaid. This is not to be confused with improper payments, which sometimes refers to like technicalities, like we didn't get the form, page 3 on form D5 or whatever it is. Nobody has like the obviously exact numbers on fraud because you can't tell. You don't know. But DOJ, HHS, and remember, Medicaid is administered by the states. So they go after this. In all the fraud that they found, which is basically in line with private insurance fraud, health insurance fraud, incidentally, they have found that none of it comes and is perpetrated by beneficiaries. It's all by providers. It's by
Nursing homes,
ambulance driver, companies, healthcare providers. I mean, I don't know what else to call it. It's middlemen.
The private equity that owns nursing homes, by the way.
I mean, they increasingly, that's where they're finding it. And so remember, again, don't confuse it with improper payments. Some of that may in fact be legitimately improper, but some of it is just a question of have every form been filled out. But the December 2024 report put out by the DOJ and the HHS Office of the Inspector General, incidentally, Inspector General, those 18 Inspector Generals who were fired from all those agencies, their job is to find fraud and waste in their agencies. Yet they were fired. The December 2024 report lists examples by the different kinds of fraud against Medicaid and Medicare that agencies have identified and prosecuted. Among those convicted, ambulance service providers, durable medical equipment suppliers, diagnostic labs, nursing homes, pain clinics, pharmacies, physical therapists, physicians, substance abuse treatment providers. No beneficiaries. No beneficiaries. So the point is like, you can put more cops on the beat, but if you cut Medicaid payments, the only thing that's going to happen is you're not going to reduce the amount of fraud. The fraud's still going to be there. The fraudsters still exist. The medical suppliers are still there. The ambulance companies are still there. The nursing homes are still there. The only difference is that less people are going to get Medicaid. That's it. So they talk about fraud and abuse. Here's Mike Johnson. We're not going to cut Medicaid. We're going to get rid of fraud and abuse and waste. First off, when we talk about waste, we know the administrative costs for Medicare and Medicaid are about a fifth of what they are for private insurance. Mm-hmm. So when we talk about fraud, there is one way to go after fraud. It's the exact same way you would if you were a private health insurance company. You get more investigators, which would actually maybe you would cut down and maybe it would pay off. So you could add more investigators, but cutting only boots people off. Go ahead.
You said that this is just the start of the process. Can you say unequivocally that further down the line, there won't be any cuts to Medicaid programs?
Yeah, so look, let me clarify what we're talking about with Medicaid. Medicaid is hugely problematic because it has a lot of fraud, waste, and abuse. Everybody knows that. We all know it intuitively. No one in here would disagree.
Pause it. We know it intuitively? Why do we need to? Why do we know this intuitively? We have reports. We have reports. And there is, in fact, fraud in Medicaid and Medicare, and also in private health insurance.
But you know, when you say intuitively, it's essentially like saying
article of faith.
Trust
We don't
me,
need
bro.
to.
Trust me, bro.
Don't look at the numbers. Don't look at the numbers. And here's the thing: there is no way that DOGE sees Medicaid fraud. It is administered by the states. It is done, like you have investigators who go after this stuff, professional investigators who know exactly how this is done, who have years of experience. They may be understaffed, woefully understaffed, but they exist. Congress does not have the ability to say, like, oh, this, we noticed in your line item that there's a line item for fraud. We're going to cut that out. We're going to take that number. They're just picking a random number that they think they can sell to the American public. That is intuitive. There is no way to cut fraud other than hiring investigators.
Well, they're hiring the ultimate investigator, Elon Musk. That's basically what their argument hinges on now.
Rick Scott on the case, too.
Yeah, trust Elon Musk. And I got news from Mike Johnson. The trust for Elon Musk is plummeting when it comes to the public. People are not thrilled about the unelected billionaire who's ransacking the federal government. Do we have more of his response here?
Good.
Cuts to Medicaid programs?
Yeah, so look, let me clarify what we're talking about with Medicaid. Medicaid is hugely problematic because it has a lot of fraud, waste, and abuse. Everybody knows that. We all know it intuitively. No one in here would disagree. We had a hearing in budget just last week, or week before last, and they asked the experts, and the estimate is, I think it's $50 billion a year in fraud alone in Medicaid. Those are precious taxpayer dollars. Everybody is committed to preserving Medicare benefits for those who desperately need it and deserve it and qualify for it. What we're talking about is rooting out the fraud, waste, and abuse. Every taxpayer, it doesn't matter what party you're in, you should be for that because it saves your money and it preserves the programs so that it is available for the people who desperately need it.
But here's the thing that doesn't make any sense, right? Like, if you had a retail store, and there was 10% theft going on, would your response be like, okay, well, if we're having 10% of our inventory stolen, what we'll do is order and maintain 10% less of an inventory, and then they won't be able to steal it? I mean, that's the logic of cutting Medicaid because you say there's fraud in it. No, you actually should add money to Medicaid to hire more investigators.
And it also is so frustrating to hear this come from him when this is supposed to be Congress's purview, right? I mean, if there was that amount of waste, fraud, and abuse, did that just crop up over the last year after you agreed to the last budget? Or are you just essentially saying, well, there always has been this billions and billions of waste, fraud, and abuse, but we agreed to it previously and didn't call it out.
What they're trying to imply is, and this is what the implication is, right? That it's the beneficiaries who are committing the fraud.
Yeah.
Because when you go down the street and you see somebody with Medicaid, and they can go see a doctor, they want to put in your head that they have that illicitly. Yeah. But there is no Medicaid fraud from beneficiaries.
Yep.
It's the same thing.
It is all providers.
Yeah. with immigration, where they focus on illegal or violent criminals when actually they're trying to go after even people here.
And
it's undocumented.
It's the same dynamic that Sam's describing, where they want people to, in their grocery store, look around look over their shoulder. Like, am I being looked at differently because I may be Hispanic or Latino? Are people wondering if my papers are here? Can we just pull up this KFF map? Because I think it's important to see where Medicaid is across the country. Apparently, in terms of percentage, the highest percentage is in New Mexico at 34%. That's if you put your cursor over it, you can see 34% there. But right next to it, right afterwards, is Louisiana, which is the home state of Mike Johnson. 32% of nearly a third of folks in his home state receive Medicaid coverage. This is 41 out of the 50 states now expanded Medicaid under the ACA. They're targeting these, I think, 20 million people who were added to the Medicaid rolls under the Affordable Care Act, which is the easiest way for them to cut. But like, these are states that agreed to it. And the federal government essentially subsidized it and then shared the administrative costs with these states, because they basically, the calculation under the ACA was like, we're going to offer this to them for free. And eventually, even these Republican states are going to say, well, we want to give health care coverage to our constituents. And they added 20 million people. There are still 9 states that held out. But Louisiana used to have a Democratic governor until recently, and they expanded. And now it's one of the highest percentage states of Medicaid recipients, much higher than the national average of 1 in 5. So there you go, Mike Johnson. That's the representation that he is giving to his constituents.
Again, this is all about reducing the number of people on Medicaid. This is not about stopping fraud. There is no, if you want to stop fraud, you hire more investigators. You do not cut aid to beneficiaries. And then the other way that they're going to do this is, and this dovetails into it, when they say fraud, they're not talking about who actually commits the fraud. The hospitals, the doctors, the ambulance companies, the medical device providers, et cetera, et cetera. They're trying to imply that the people who have a Medicaid card, they're the ones who are committing the fraud. And then the next step is we're going to put a work requirement on them, because they're just, all these lazy people are sitting around just so they can get their Medicaid. And we know, we've seen these experiments. In Georgia, they they got a waiver to do a Medicaid experiment. And ProPublica, along with The Current, did a deep dive into this. They had a program called Pathways. And it was an experimental alternative to Medicaid expansion. It has cost taxpayers more than $86 million. And there was a huge enrollment shortfall. Only 6,500 participants enrolled in the first 18 months of the program, which was about 75% less than the state had estimated for year one. I don't even know what that means when you go a year and a half into it. It also slowed down work. The state found it difficult to verify that people are working to keep their benefits. So Georgia has gone from monthly checks to annual ones. It's been a complete disaster.
Yeah. And also, there are millions.
More expensive.
More expensive. They don't care about that. I mean, we know that Cobra is more expensive than if we were to have temporarily expanded Medicare during COVID, but we didn't do that because of the pitfalls of allowing people to imagine a reality where the government provides them with health care. There are millions and millions of people on Medicaid who are working already. So these work requirements are basically meant to target that small percentage of people who need it for disabilities and for other reasons. And maybe they haven't been able to find work because our economy is crap, which the Republicans keep saying, by the way, even though now that Trump's in office, we're supposed to not care about it anymore.
This is the only state in the country that has work requirements for Medicaid, and it has been an unmitigated disaster. It cost more just to try and verify. And they couldn't get people to, and they have less people covered.
Yep.
It doesn't get people, well, I was trying to get away without working, and now I'm going to go out and work now so I can get the Medicaid. As if this is why people are not working.
Yeah, I mean, KFF did this analysis too in 2023. Among adults under 65 with Medicaid who do not receive benefits from the Social Security disability programs, supplemental security income, and Social Security disability insurance, and who are not also covered by Medicare, referred to hereafter as Medicaid adults, 92% were working full or part-time, and the part-time is 64%. So, or not working due to caregiving responsibilities, illness or disability, or school attendance. So they're talking about 8% of Medicaid adults.
And of that number, you had retirees, you had people unable to find work, or were not working for some other reason. So we're talking about a very small percentage of people who are not working because they just don't feel like it.
We have it's the working poor. There was an analysis years ago that Walmart and McDonald's are some of the top employers of people who are on Medicaid and food stamps, but working at those jobs. They're working. We live in a country where you can work full time and not be able to afford to pay your rent or come close to it, let alone if you have a family. So there are people who are working all the time and are still on Medicaid and food stamps.
And corporations like Walmart know that they can work with the government to keep those people on a treadmill.
They outsource it. Yep. It's actually a huge benefit to these mega corporations that they don't have to worry about providing a living wage for people because, hey, the taxpayer will foot the bill. We should expand these programs, but we should also force corporations to pay a higher wage. You know what a really efficient way to run the government would be to raise the minimum wage, which we haven't done in years, even in this massive inflationary period on the federal level, so that perhaps other people wouldn't have to rely on some of these government programs when they're already employed. And we're in such a low employment period, but the cost of living is so intense that people are resentful of the economy, rightly so.
Calm makes art. I work while on Medicaid. The yearly coverage for my chronic illness last year was over $80,000. I make $20,000 annually, and I'm stuck in low-paying jobs. No way I could cover that without it. Nicola, I have an awesome plan through Medicaid in Pennsylvania. I bust my ass. I still qualify, though, just barely, because I get paid crap, no benefits, in spite of working full-time. I am not unique. I despise these people.
Nope.
I mean, this is the story of Medicaid in this country. And what you're seeing is like a full court press by all the Republicans to come out and basically claim that the government across the board, to justify Elon Musk's completely random firing spree, fueled by, who knows what, ketamine and blow and Twitter rage, going through and firing government officials willy-nilly, firing people who are experts. They fire everybody who's gotten a promotion. So you're looking for government efficiency. Your first fire are people who are probationary. That means people who have had a promotion in the past 6 months. You're firing the people who have been doing the best. Then you're firing new experts brought in to deal with things like AI and new medical devices. They had to rehire some of those people at the FDA. Then you're accidentally firing the people who are in charge of our nuclear weapons. Like, this is not a surgical thing. This is just simply an assault on government, period. Mm-hmm. And when they talk about fraud in Medicare, they make it sound like there are all these people walking around with Medicaid, or I said Medicaid fraud. There are people walking around with Medicaid cards who don't deserve them, who have been fraudulent, but none of the fraud are beneficiaries. It's all suppliers. And then you get guys like this guy sort of a central casting evil capitalist from Canada in this instance, an import, who is opining about the wastefulness of government and knowing exactly zero about what he's talking about. Watch him get faced. He is on. He is
Laura
on.
Coates Live.
Yeah. Laura Coates Live. He's on with a guy named Tom Malinowski. I don't know who Malinowski is.
He's a former rep from New Jersey.
Former representative from New Jersey.
Yes, you can't be surgically precision. There's no way to be surgically precision.
Sorry, we watch everything at.
A million speed.
Yes, you can't be surgically precision. There's no way to be surgically precision in this. You have to cut more because you just don't know. There's no way to do it. Remember, we've never audited government for 100 years. Never done this before. You may not like it.
Tom doesn't think that's right. Tom, what's your reaction to that? There's government's not audited.
Every agency of the federal government, it helps to know some things if we're going to have this debate. Every agency of the federal government is audited by independent inspectors general. USAID was audited over 60 times last year. And one of the first things that Donald Trump and Elon Musk did was to fire all of the inspectors general. They fired the auditors and they put in charge this billionaire with his 50 child interns who know absolutely nothing about the federal government. And Kevin, like what you're talking about, it might work for a company that makes widgets, because we can do without the company that makes widgets for a few months while you get in there and you restructure it. You can't do that to the FAA unless people aren't going to fly in planes for the next 4 or 5 months. You can't do that to the Defense Department unless you don't want to defend this country for the next 4 or 5 months. That it's ridiculous that we're even having this argument. And I'm someone who believes there is waste in government and there are ways to get at it, but not by firing everybody first, shutting things down while you investigate. Do the investigation, work with Congress, work with these employees, do it right. It's been done before.
I would add, you can't shut down food safety for months. You can't shut down environmental protections for months. You could say that health insurance, you could go on and on and on. And to the extent that there is waste in government, we know what it is. We know what it is. It is lobbyists coming in, donors feeding at the trough. It is contracts to Tesla for $400 million worth of electric armored pickup trucks that they have. I mean, that's where the waste is. The waste is a function of people just like that dude on that panel who's donating money and wants his tax breaks, wants his subsidies for his company. That's where all the waste is. I mean, it's this notion that, but they need to malign government. And this is why it's been so bad when the Democrats decided to join in this chorus in the 90s. It was inevitable that it was going to lead to this place where you start to create this notion of government being bad. And frankly, we were fortunate in some respects to have the American Rescue Plan in 4 years ago, where people actually saw like a material benefit from the government, so that there's still sort of like some muscle memory as to the government actually can help me.
Yeah, right. I mean, and I think the planes falling out of the sky is a kind of visual metaphor for all of this, which is that we need more government, less austerity, more air traffic controllers, more workers keeping us safe, more people inspecting our food. If there's anything that comes out of this past horrific month, it's hopefully like a broad understanding and a resistance that's based in government being good. That is the one thing about this time around where you have a little bit more hope, where we're not focusing on Russia to begin Donald Trump's first term. We're focusing on the core tenets of government and how it functions and what it should do for people in our society. It's more educational this time around, even though it's more painful, I think, and they're way more extreme.
And the economy is going to
Collapse, most likely.
Collapse, yeah.
Well, we'll get to that. We'll get to some polling and consumer sentiment in a bit. I mean, I was saying I went into what do you call it? Key Food, and there was like no eggs.
Oh, yeah.
It was nuts. Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.